guys, my name is Chaya Chauhan and I own True Smile Dental Practice. Just wanted to talk to you in this video a little bit about dental emergencies and what we are still offering as dentists. Although our dental practices are shut down, we are still available on the end of a phone, so if you have any problems you can always phone us and we can talk through certain problems and give you some advice. There are some things that are classed as dental emergencies which are really urgent that if you have, you must go straight to your local A&E. So for example, if you have a tooth that is swollen or is causing pain, but all of a sudden the swelling has gotten really big, you're finding it difficult to breathe, difficult to swallow, and you can physically see the swelling on the outside, then you must go to A&E, because when these swellings get really big, they can restrict your breathing and you can end up having further problems. So if you go to A&E, they'll be able to give you IV antibiotics and they'll be able to reduce that swelling and allow you to breathe properly again. Another really serious dental emergency is a socket. Say if you've had a tooth taken out and the socket is bleeding and bleeding all the time. So if it doesn't stop bleeding, even though you've put pressure on it, you've had like a dental pack or a handkerchief or something, you've rolled it into a tight little ball and you've bit down on it for 20 minutes, nonetheless you've bit down on it and it's sort of soaked through, and then you've changed it and changed it and changed it, and after 20 minutes it's still bleeding just as much, that's another reason why you should go to A&E. So A&Es at the moment, hospitals are so busy, so we don't want to send anybody who doesn't need to go there to an A&E, but if it's a serious problem like that, then you must go. Sometimes when you do have a tooth taken out, your socket is bound to ooze for the rest of the day, and what happens is it's a bit like if you cut yourself, you bleed initially but then it heals, but you get that sort of oozy stuff for the rest of the day or so, and then that little bit of blood can mix in with your saliva and can sort of be a pinkish, and you think, oh, I'm really bleeding. So that sort of bleeding is sort of expected after a dental extraction. But if you have a full-on bleed, so it's not gotten any better from when you first had the extraction done, or you've knocked it, or for some reason it's sort of really bleeding and bleeding, you may have some underlying health issues, you may be on blood thinners or have some problems with your blood, then you must go to A&E. Other problems that we can give you advice on the phone over, or maybe we can sort of give you some sort of prescriptions for, are things like severe toothache. For example, if you have a hole in your tooth and it's been hurting you for a long time, you think, oh, I'll sort it out later, it's fine at the moment. But one day it really flares up and it's really, really painful, and you have a swelling on the tooth and the swelling is on the side and a slight swelling on your face, but you can breathe, etc. okay, then you can go to your dentist and they may be able to give you a prescription to help that, or give you some advice about it. Or if you've lost a filling, or you've got denture problems, you've lost a crown or something, or you've chipped a tooth, that is sort of a routine emergency, so you can ring your dentist and they can give you advice for it. Another thing that is a dental emergency though is if you were to have trauma to a tooth. For example, you fell over and you've lost your tooth, or something has happened along those lines. For example, I've just had a phone call earlier today. I've come into the practice, as you can see, and I'm doing triage. So there was a young mum and her son fell over and the whole tooth came out, basically. It was an adult tooth and it was partially erupted. So what we did was, I asked her if she had the tooth. She did have the tooth. I asked her to store it in milk and literally place it back into the socket again. If you do this under the instructions of your dentist and you do it correctly, then sometimes the tooth can take, but do contact your dentist and do get advice about this. I'm going to be doing some further videos about other things, so if there's any questions, then please do let me know. If you're one of our patients and you would want advice from me, then please do phone us on 01268 544 218. Thank you.